Hello and welcome to this webinar on the homeopathic treatment of pandas and pans. I am Dr. Jamie Oskin, and I am so excited and grateful that you're here to hear this talk. You know, I want to tell you a little bit about myself. I'm a naturopathic doctor, and I got started seeing kids with developmental conditions when I was a resident, and it really touched my heart. And even though my residency started in general family practice, quickly I learned through some cases when I was able to help kids with homeopathy that my true passion was to help these kiddos get better, because it just made my day when I would see a kid get better. And, I remember these early cases in my residency. Like, I had a little boy who had recurrent ear infections and had 15 rounds of antibiotics in 22 months. And he had ear tubes, and he was still getting antibiotics every 3 to 4 weeks for a new ear infection. And it just broke my heart. And once we started treating him with homeopathy, he started getting better and better. And I think in over 6 years since I started treating him, he's had 1 ear infection. Because his immune system got healthy, he got healthy, and he stopped getting sick. And that was my start in getting passionate about helping kids. And as my career has progressed, I've seen more and more kids with more complex conditions. And in the past 3 or 4 years, I've been seeing a lot more kids with pandas and pans. And it's something I'm really passionate about because it's really devastating to families. It's really hard for kiddos, and I just love seeing them get better. So let's get started. On our website, on the aznaturalhealth.com website, we have a PANDAS page, and you can follow this link to get there. And on that page, you'll find out some information about pandas and pans. And here we go. I also want to let you know that in 2014, I published an article in NDNR, which is the Naturopathic Doctor News and Review, which is the first article that I know of documenting a case series of 3 cases showing improvement in pans with homeopathy. And so I encourage you to read those cases because you may enjoy it and learn something and find some similarities with your child and see essentially what we can do with homeopathy. And in this presentation, I'm going to share 3 cases with you that are totally different cases than in that article. So together, you can read and see 6 cases that we've treated with homeopathy as example cases to see how this works and see if it might be something for you. So let's get started with a story. Let's start with a case. This is a case of Julia, who was a 9-year-old girl whose mom brought her to see me in March of 2016 for the treatment of motor tics and anxiety. And her symptoms started 3 years prior. 3 years, that's a long time. After she had a bad strep throat infection that resulted in full-blown scarlet fever. And the tics, she had these tics that included eye fluttering, eye rolling, and shoulder shrugging. And Julia's mom reported that she was frequently sick with ear infections and respiratory infections as a child, so we could see in her history that she had a predisposition to getting sick frequently and that her immune system was a little wonky. And in addition, she would about once a month get these abdominal migraines that would lead to vomiting. And in kids who have migraines more often have abdominal migraines rather than head migraines. So I ran some initial blood work that showed that Julia was positive for strep titers, which helped confirm the diagnosis of PANDAS, along with her clinical history of the tics that started abruptly after she was sick with the scarlet fever outbreak 3 years prior. And, there's some unique symptoms in her case, and we're going to talk about this, but in homeopathy, every individual case of PANS or PANDAS is treated uniquely based on their unique individualizing symptoms in that specific case of disease. And so for this child, her symptoms were significantly worse in the heat of the sun, in the spring, after she would mentally exert herself, like after a long day at school, and also after she became internally overheated. Now, these individualizing symptoms may seem bizarre if you're thinking in conventional medicine terms, because you may say, well, who cares if her tics are worse than the heat of the sun? But for me, those symptoms are key to helping individualize her case to pick out the very specific homeopathic medicine for her unique case of PANDAS. So I prescribed a homeopathic medicine called belladonna. And on the right, you can see a drawing illustration of the Atropa belladonna plant. And it's really easy to take. The medicine is diluted and put in a very small dose onto sugar pellets. They come in a medicine with an FDA label. And those pellets dissolve in the mouth. And Atropa belladonna is a famous plant. It's been used in medicine for several hundred years. And the most common thing we think about nowadays is atropine, which comes from like Atropa belladonna. Atropine is the drug that is used by eye doctors to dilate your eyes when you go in for an eye exam. So there's still many chemical drug substances that were derived from this plant. And we use it homeopathically as a diluted form of its original whole plant substance. And in PANDAS, belladonna is very frequently indicated as a remedy in cases that develop symptoms after an episode of scarlet fever, especially with tics, emotional outbursts, and sensitivity to the sun, as well as some of the other unique individualizing symptoms in Julia's case. And even though it wasn't present in Julia's case, in some cases that benefit from belladonna, the child will have violent outbursts and dilated pupils. Now I wanted to show you how I analyze a case to figure out how would I prescribe belladonna. So this is a picture of a repertorization chart, which is a computer program that I use to put in all the symptoms of the case and to help me find the best matching remedy. And so you can see here on the left are all the symptoms, the spasmodic contortions of the limbs, the tics of the face with the distortion of the face, the involuntary movements, the spasmodic choreic movements, the aggravation after a scarlet fever, the aggravation from the heat of the sun, from being internally overheated, and the aggravation from mental exertion. And you can see here that the medicines are listed over here, belladonna, ignatia, bryonia, and only one medicine came through the analysis matching all of the symptoms. So we're going to talk about the law of the like cures like, or the law of similars in homeopathy. But basically, we're trying to find the best match in a medicine to the exact symptoms of the case. And since only one medicine came through, and when we read it in the books, it seemed like a good match, that's what we gave. So what happened in Julia's case? Well, after the first month of treatment on belladonna 30C, she was taking 2 pellets once a day dissolved in her mouth. She had a significant reduction in her tics. The eye rolling was much less frequent, and the rapid shoulder movements were now barely noticeable, and her anxiety was diminished. Julia continued to make sustained improvements at her second and third follow-up visits after starting homeopathic treatment, with a 65% reduction in tics by her 3-month mark. Now, just prior to her third visit, there was a slight relapse in tics, so I increased the potency of belladonna to the next potency, which is 200C, and we had her take 2 pellets dissolved in her mouth daily, which then stimulated the tics to continue to improve again. And, so with this case, it brings up some points. With an accurate homeopathic remedy, often very long-standing symptoms can start to improve in the first month or 2 of treatment. In this case, Julia was sick for 3 years before coming to see me, and even in the first few months, she had a significant reduction in her symptoms. But because the disease is really long-standing, it may take a few years to fully cure Julia of her tics so that she's no longer prone to have tics or to relapse under stress or after a new infection, like a new strep throat infection. And in cases like Julia's, with steady, consistent follow-ups over the course of a few years, the tics will continue to diminish and eventually will fully resolve or be so minimal that they'll no longer interfere with her daily life. And this is a pretty typical case example where the symptoms improve after an accurate prescription. And then after a while, there becomes some desensitization to that particular potency, and so there's a slight relapse. But if we catch it quick and go up in potency, then the symptoms begin to improve again. And I'm going to explain that again further in the talk with another case example. But I hope you see how Julia's case is a good example just to start off our presentation for how we can help a child with PANDAS. So how can homeopathy help your child? Well, we can help tics, OCD behaviors, and OCD symptoms, anxiety. We can very much help separation anxiety, sensory processing problems. So a lot of kids with PANDAS also have sensitivity to lights, noises, odors, pressures, touch, sensitivity to to clothing pressure on their skin, and these symptoms can be helped with homeopathy. We can also help tantrums, violent behaviors, mood fluctuations, and personality changes, bedwetting, which many of these kiddos have. And, I want to point out that homeopathy is a holistic therapy. So when we treat a child with PANDAS or PANS, we're also treating the whole body. So if a child suffers from other problems like skin rashes, chronic recurrent ear infections, allergies, digestive problems, or other health concerns, these issues also can be helped because we're treating the child holistically. And the best part is homeopathic remedies are really easy to take and they taste good. So most kids like them, even really finicky eaters. Now I have a book recommendation for you if you're interested in learning about homeopathy. This is called Homeopathy Beyond Flat Earth Medicine by Tim Dooley, and he is both a naturopathic doctor and a medical doctor. And it is a great introduction to homeopathy that helps answer questions about being a homeopathic patient. And you can download, if you go to this website, beyondflatearth.com, you can purchase the second edition of the book for about $11, or you can download the PDF of the first edition for free, in which case you could read it on your computer or on an iPad or another digital device that reads PDFs. Great book, really helps patients understand what homeopathy is and the process, and really, I think my patients who read this book find it very valuable, and it helps them a lot. So what is this thing we keep calling homeopathy? Well, homeopathy is the method of using medicines, and we call them remedies. It's an old term, but we call them remedies, to help treat or cure illnesses according to a principle like cures like. And there are three underlying concepts in homeopathy. The first is holism, meaning we look at the case holistically and treat the whole person. The second is individualization, and the third is a Latin term here, the vis medicatrix naturae. So let's look at the first one, holism. The way we look at disease with homeopathy is that disease is often rooted in a problem of the person as a whole, and there's more to the whole than the sum of the parts. So if a child has multiple concerns like constipation and tics and violent outbursts and maybe some other problem, we look at all of those things together and try to find a matching medicine that will stimulate self-healing for all of those health concerns and not use a different medicine for each different complaint. Because even though conventional medicine may see them as unconnected different problems, in homeopathy we realize that holistically they are all part of the same dysregulation in the body and part of the same syndrome of illness. And therefore, if we stimulate the body to heal as a whole person, all of those problems will improve simultaneously. Now, with individualization, what we recognize in homeopathy is that disease expression often varies from one person to the next. And I've seen lots of cases of pandas, and they can have very different features. Some kids have violent outbursts and tics. Other kids have more OCD and bedwetting. It just depends on each unique case. And the way we look at that in homeopathy is, instead of just having a shotgun approach to give a medicine for the diagnosis, instead we look at the individual differences in each unique case, and that helps guide our selection of the homeopathic remedy to be very specific for each unique case. And so two people with the exact same disease, both have PANDAS or PANS, could receive different homeopathic remedies. And the individual differences in the way the disease is expressed are what we use to prescribe the remedy. And that's why in that belladonna case I showed you, she had these tics, but Julia was particularly sensitive to things like the sun. Heat of the sun aggravated her tics. And that very specifically helped individualize those things that made her symptoms better or worse, individualized her case to help me pick belladonna in that specific case. But another child, let's say, that would be aggravated by cold and not from heat, may get a totally different remedy. And lastly, the vis medicatrix naturae. So this is a Latin phrase by the famous old Greek dead dude Hippocrates that doctors swear by the Hippocratic oath when they become doctors. He came up with this phrase, and it means that there's the healing power of nature, or there is a self-healing tendency in all living things. And that ability is what's stimulated and utilized by homeopathic treatment. And so when we give a homeopathic remedy that's well matched to the symptoms of a unique case, it helps stimulate the immune system in an infectious disease or an autoimmune disease like PANDAS or PANS to normalize and re-regulate. So unlike conventional medicine, in conventional medicine, often a medicine is used to combat something or suppress a symptom. So, for example, if someone has heartburn, they may take an antacid to shut down the acid. But in homeopathy, the medicine is working to stimulate the body to do the healing. So in conventional medicine, the drug is doing all the work. In homeopathy, the medicine is simply a tool to stimulate the body, and then it's the body that's doing the self-healing. Now let's just take a quick detour, and I want to tell you a little bit about the history of homeopathy. So this is a daguerreotype of Hahnemann from Paris in 1841 at the end of his life. He was a famous physician, and he's the one who discovered homeopathy. In fact, he is the only physician that has a monument dedicated to him in our nation's capital in Washington, D.C. That tells you how prominent he was in the history of medicine. And to have a daguerreotype was a precursor to a photograph. So to have one of these taken to you to sit for a portrait in the mid-1800s meant you had to be pretty well known. He was quite famous at the time for his discovery of homeopathy. And he was a German-born doctor. And during his time, he was turned away from medical practice at the time because you can imagine how terrible they were. You know, the main things at the time were things like bloodletting and mercury poisoning, leeches. And, if you went to the doctor in his day, you had a 50-50 chance of living or dying because the medicine itself was so horrifically toxic and dangerous that he couldn't live with himself, and he had to give up medicine just to be able to cope with his own issues with medicine. And so to make a living, here he was a doctor, he decided to translate medical texts for a living. And he was a bit of a genius. He spoke about 9 languages. And by the time he was in his mid-40s, he had translated over 5,000 pages of medical texts. And to give you an idea, some of his translations were considered the most prized translations in medicine and chemistry at the time. He was also a chemist, and he translated some of the most famous chemistry works in the late 1700s and early 1800s. And people would refer to Hahnemann's translation because he would actually even correct and make additions that were valuable to these these famous works. And so it was while translating a famous book by William Cullen, who was the head of Materia Medica teaching at the University of Edinburgh in Scotland. William Cullen had a famous textbook on Materia Medica, and while translating that book into German, Hahnemann came across some interesting information on the cinchona bark. And what happens when somebody has a toxic overdose of the cinchona bark is that they get an intermittent fever, very similar to malaria. And Hahnemann postulated, well, what if it's based on similarity? There are other doctors like Hippocrates throughout history who made claims that perhaps there is a curative effect in similarity. If we give a medicine that produces symptoms similar to the disease, that it will stimulate the body to self-heal. And at the time, the main theory of how cinchona bark helped malaria was by its chemical properties, say like as a bitter or astringent medicine. And Hahnemann thought, well, I don't think that maybe is true. Maybe it's based on similarity because its toxic symptoms are very similar to malaria. And so what he did is he embarked on an experiment where he poisoned himself. He took an overdose of cinchona bark until he ended up developing symptoms very similar to malaria. And it's really striking because one of the constituents in cinchona bark is quinine, which till this day in modern medicine is still one of the main treatments for malaria. And so at that point, Hahnemann went about experimenting, and that was in 1790, and he ended up experimenting for 6 more years about this idea of like cures like before he published his first paper in Hufeland's journal, which was a very famous journal of that time in Germany, where he announced his idea to the world about homeopathy and like cures like. And like cures like is the main concept in homeopathy. Everything else is an afterthought. But if I can really impress upon you, the main principle of homeopathy is like cures like. And there are a couple others that we'll review using a minimum dose of medicine and also one medicine at a time. But like cures like is the main show. And Hahnemann coined this term, homeopathy, to describe a phenomenon. You see in the Greek this funny letter O-M-O-E-O. That's a diphthong or a ligature that is indicative of the origin of the word in Greek, omion, which means similar. And pathos in Greek means disease, so similar suffering. And Hahnemann also coined the terms for antiopathy and allopathy, which are still commonly used terms today. And by allopathy, he meant something that had no logical relation to the disease, allos, meaning other than. So by homeopathy, what he meant was that the medicine produces similar symptoms to the symptoms of the disease. And we apply the medicine based on that similarity. So let's look at medicines in some pharmacodynamics. Now, this is going to get a little nerdy, so hang on to your seats. But I want to explain this because it'll help give you the idea of homeopathy. So all drugs have a primary or a first effect on the body and then a secondary effect, which is a reaction of the body against the drug. And so if we look at some common drugs, beta blockers like propranolol, the primary effect used by those drugs is to lower the blood pressure and the heart rate. Now, all doctors know that you can't stop one of those drugs cold turkey because if you stop it right away, the rebound reaction of the body is to increase the blood pressure and worsen the heart rate after the drug is taken away. What about this drug, Vyvanse? It's a famous stimulant, ADHD, and weight loss medication. It was started as an ADHD medication, and then one of the side effects of this medication is that it blunts the appetite and causes kids to lose weight or have stunted growth and stunted weight. So they thought, well, let's get it approved as a weight loss drug. Well, the first effect of the drug is to produce weight loss. But, it's really interesting. When they look at kids long-term on stimulant ADHD medicines, when they're teenagers, if they come off of the medicine, the long-term rebound reaction is that they have rebound weight gain. So there's always a first effect of a medicine and then a secondary reaction of the body when you take the medicine away. Let's look at proton pump inhibitors. These are those famous drugs for stopping acid. So if somebody has heartburn or acid reflux, the first effect of the drug is to stop acid production. And the second effect of the drug, if you stop these drugs cold turkey, you get rebound hyperacid. The acid actually worsens if you take away the drug. Now, if you're going to use medicines based on opposites, which is how most conventional medicine works, you always prescribe a drug that has symptoms that it produces an effect that's opposite of the symptoms. And the body's response to that, if you then take away the drug, the body's reaction to that, it's a homeostatic or a back to normal physiology reaction to that drug, is to worsen the original problem. Now, if we flip that coin and say, well, what if we gave the drug based on similarity? What if in a person with excess acid because they had acid reflux, what if we gave them a medicine that produced even more acid in a very small dose? Then the body's response when we stop that medicine is to go in the other direction, away from the medicine, and that is back towards normal health. That's homeostasis. And that's the way homeopathy works. There's a first reaction of the medicine, and then the body's response against the medicine is to go back towards health. Like cures like. And there are several examples that we can think of. We use stimulant medicines for ADHD, which seems kind of odd because you would think that you should give a slow you down drug, not a rev you up drug. And what about allergy shots? When you go to an allergist for allergy desensitization, they give tiny doses of the allergy that the person is already allergic to. And if they gave big whopping doses of that allergen, it would make the person really sick. But if they give a tiny dose, just enough to trigger the immune system to respond to it, it seems to have a health balancing effect. So these are other examples in conventional medicine of like cures like, just like allergy shots. And when we do it with homeopathy, we use medicines. So how do we figure out which medicines to use? And that's where we have the Materia Medica. And the Materia Medica are basically these big books that have a listing of symptoms that teach us what medicines to use. And Hahnemann came up with the term proving from the German Prüfung, which meant, which got translated into English as proving, but it was basically the first methodical drug trials in medicine. And these experiments were done on healthy people. And you may say, well, why did Hahnemann do experiments on healthy people and not on sick people? And the reason is that if you give a single medicine to a healthy subject, you have less variables. If you give a medicine to a sick person, you have multiple variables. You have to try to differentiate which symptoms were produced by the medicine and which symptoms were produced by the disease so that you separate out which effects are which. But to have less variables to very clearly know the effects of a substance, if you do that experiment on a healthy person and now see the symptoms that get produced after taking that medicine, now you can clearly see the effects of that medicine. And then those symptoms that the experimenters would experience when taking a substance would be recorded in a database that we call the Materia Medica. And so these are books that we use to try to match the symptoms of the patient to the symptoms of the remedy. And that's how we know which specific remedy to give in each unique case. So let's use some simple examples of like, cure, like, so that you can get an idea of what it is. So let's say a healthy person is given coffee, and let's say they're really sensitive to coffee like me. For me, if I have a cup of decaf on the weekend as a treat, it sometimes keeps me up at night, even if I have it in the morning. So if I had a Trenta super powerful black coffee from Starbucks, I'd be up for a week because I'm really sensitive to coffee. And you can imagine what symptoms it gives. If somebody overdoses in coffee, they might get a rapid heart rate, and they might get jittery, and they might start thinking really fast and talking really fast, and they might be excessively happy. And that may make them hard to sleep. So you can imagine, let's say a person has similar symptoms, like their mind is racing. Let's say it's like a little kid who's so excited the night before Christmas to get their Christmas presents, and their mind is racing just dreaming about all the different Christmas presents they're going to get, and they're so excited that they can't sleep at night. So in this case, by similarity, we might give a patient a tiny dose of coffea cruda, which is crude coffee, because by similarity, the symptoms of that child would be very similar to symptoms produced by an overdose of coffee if somebody was particularly sensitive to coffee. And that would stimulate the child to then go to sleep. Let's look at another example. This is the allium cepa, which is the red onion. And you can imagine if you were in the kitchen chopping up a really fresh red onion, that you might get symptoms like burning, tearing eyes and clear nasal discharge. Now, if you think, well, what kind of diseases could we use a small dose of red onion for? They might be symptoms of the common cold, or maybe even allergies, like what we call allergic rhinitis, hay fever type allergies, where the patient has similar symptoms with maybe burning tears, burning teary eyes, and clear nasal discharge. And when a sick person has hay fever symptoms that are very similar to that, we could give allium cepa, and it would stimulate their body to self-heal. So now with these examples, with the coffee and onions, we all know coffee and onions, so we can start to think to ourselves, what are the effects of coffee and onions? And that can give us an idea of what symptoms we would treat in a sick person who had similar symptoms to an overdose of coffee or exposure to red onion. But with a condition like PANDAS or PANS, the symptoms are much more complex with the OCD and the tics and the bedwetting. So that's where it takes someone who has more knowledge about homeopathy and homeopathic medicines in order to better individualize and pick the right remedy for each unique case. And that's my job. All right, so a couple more main concepts about homeopathy, and then we're going to have a few cases and wrap up. So the next main concept is the minimum dose, and that's because we want to use the safest, most gentle, non-toxic dose of medicine without harmful side effects. And Hahnemann found that medicine should be specially prepared. And over the course of about 40 years, we have documentation by reading the literature that he gradually experimented over 40 years from using the crude doses of drugs of the day, and gradually he kept using smaller and smaller doses in an attempt to see how safe we could make the medicine. And he didn't do this very quickly. It happened slowly over 40 years. And what he eventually found is that as long as the matching remedy is very, very similar, it's a really, really good match, that we can continue to dilute the medicine down, and at each stage of dilution we succuss it, which is a form of agitation. And so there's a dilution and a shaking of the medicine, which then makes the medicine active even in highly diluted forms. And this makes it incredibly safe and gentle. So the more dilute, the less toxic and the less side effects. So that's really good news, for patients who want a gentle, safe, natural approach. The other thing is that more dilute means less expensive. The medicines themselves are not generally that expensive. At the time that I'm making this webinar, most homeopathic remedies cost between $10 and $25 for a vial that lasts 1 to 2 months. So that's pretty cheap for medicines compared to a lot of other supplements or medicines that are on the market. And the production of homeopathic remedies are standardized and made by several companies. Some of you may know, and maybe you've seen this product that's helped your child, teething tablets. It's a homeopathic product that's over the counter. And these medicines are regulated by the FDA. So homeopathic remedies are regulated like natural drugs, even though they're natural substances. They have FDA oversight and regulation. So they're very, very safe, very well controlled, good manufacturing processes. And lastly, on this theory section, we only use one medicine at a time. And Hahnemann said that those people who practice homeopathy the best can expect the best results when using one remedy at a time. And there's good reason why. So if we use one remedy at a time, it allows a more pure reaction and it's more individualized. And it helps us assess the case more easily. A lot of kiddos that come in to see me with PANDAS and PANS come in with a laundry list of 20 or 30 things that they're taking. They're taking antibiotics and antivirals and antifungals, and they'll maybe be taking antidepressants, and those are just the drugs. And then maybe sometimes they'll be on tic medicines or antipsychotic medications if they have violent behaviors. And then they'll be on a list of supplements just as long as the drugs are even longer. And sometimes I say, gosh, to the parents, I say, that must be costing you a fortune every month just to have that shopping bag of stuff. And to try to coordinate the whole schedule of when the kid takes what is like a zoo. And in addition, oftentimes I ask the parent, well, which stuff is really helping? And they often don't know because they're taking, and they started so many different medicines simultaneously, they're not sure what's doing what. So the good news about homeopathy is that we only use one medicine at a time. And by doing that, we know for certain what is helping. And that can be a good thing and a bad thing. I mean, I think it's a good thing. If a medicine doesn't work, and you'll see this in a case I'm going to present later in this presentation, I want to know that. I don't want you spending lots of money and having your kid take lots of stuff that's not working. So I would rather start something and know that it failed and didn't help at all so that we can move on and try something else, rather than having you take lots of different things that may or may not be helping, but it's costing you a lot of money. All right. So, one medicine at a time. And the other good thing is because homeopathy is holistic, we can use one medicine to simultaneously help multiple concerns that conventional medicine would treat with different medicines. So maybe they would give you an antibiotic, and they'd maybe give you an antipsychotic and an antidepressant, and maybe a laxative for constipation. Whereas homeopathy, we want to find one medicine that will help all of the symptoms simultaneously. All right, so now that you have your foundation of homeopathy and you understand what homeopathy is, I want to delve into another couple cases so that you can really get a sense of what is possible with homeopathy for the treatment of PANDAS and PANS. Now, this is a case of Peter, who is a 14-year-old boy who became sick a year before he came to see me when he caught a strep throat infection from his sister. And prior to that, he was a very healthy teenager playing high school football. And after getting sick, he developed severe anxiety and couldn't handle going to school. And he started having episodes of catatonia, which is it's like a state similar to schizophrenia where they will be frozen. And he would look frozen, staring for about 20 minutes at a time. And the only way to break the staring spells was if his father would scream at him so loud that it would startle him out of the episode. And they said sometimes he looked like a zombie. He developed more symptoms, including OCD and tics, like jerking his head to the side. And some of the OCD behaviors included having to count a series of numbers before he could go through a doorway in a ritualistic opening and closing of doors. And he was stuck sleeping on the couch because the OCD was so severe that he felt trapped in his own bedroom and couldn't even get out of the door because of the obsessive thoughts. And he was having difficulty thinking and often had a hard time retrieving words when speaking. It was like he retreated into his shell and didn't talk very much. And he had been having these emotional rages and lost appetite with weight loss. So you can see how many symptoms from this condition. And he was thoroughly evaluated by a very excellent neurologist who used blood tests and brain imaging to rule out conditions like seizure disorders. And eventually he was diagnosed with PANDAS. But by the time he came to see me, he was on a cocktail of medications and supplements, including 2 antibiotics, 2 anti-seizure medicines, and a laundry list of 16 nutritional supplements. And despite taking all of this stuff, his symptoms were no better, and by that time his symptoms were so disabling that he had been out of school for over a year. So you can imagine how sick this kid is that he hadn't been in school for a whole year. So what did I give him? So I prescribed a homeopathic medicine called Cicuta virosa, and here's some really pretty plants of Cicuta virosa. It is the water hemlock, and I had him take 2 pellets dissolved in his mouth once a day. And Cicuta virosa is a very important remedy in cases with catatonia, staring, and spasmodic muscular tics. So I want to show you, here is an analysis with my homeopathic software, and you can see the medicines up top here: Cicuta, camphor, hellebores, belladonna. And then you can see the symptoms. We have the catatonia symptom, the staring, the spasmodic tics, the fact that he was kind of like in this zone with being unaware, and lastly, the fact that he was worse with a lack of attention. Actually, it was interesting. If he did something that he was interested in, like go-kart racing, he could totally be fine. But in other situations, when he wasn't focusing his attention, he would fall off into these staring spells. And you can see by this unique pattern of symptoms, there are only 3 medicines that have all of the symptoms. And you see that this symptom, belladonna, that was in the first case that I prescribed, has most of the symptoms, but not all of them. So it's not a good remedy for this case. So that means we have to read about these 3 medicines and see which one's the best match for this case. So I'm just going to show you, just by an illustration so that you can see, I picked out some symptoms from Hahnemann's Materia Medica Pura, which is one of our encyclopedic manuals that tells us all the symptoms that are produced by Cicuta virosa, so that you can see how similar they are to Peter's symptoms. So these are symptoms in an experiment with Cicuta virosa, the symptoms that would happen if somebody took too much Cicuta. So here we have this symptom: staring after a quarter hour. She looks fixedly at one and the same place and cannot help doing so, much as she would like to. At the same time, she has not full command of her senses and must be very strongly excited in order to answer correctly. If she compels herself forcibly by turning away her head to cease having her eyes directed on the object, she loses consciousness and becomes dark before her eyes. This symptom perfectly matches Peter's case. First of all, it has the staring episodes, and the fact that they can be stopped if they're strongly excited. In other words, somebody yells or strongly kind of gets their attention, just like Peter's dad, who would yell and shake him out of a staring episode. And in addition, it has the fact that they would be better if they were focusing their attention very acutely on something. They would be okay, but the moment they didn't, they would fall back into these staring spells. Here's another symptom. As often as she is spoken to and thereby forced out of her unconscious staring and wakened up by shouting to her, so often does she always relapse again into it, and this state of her pulse is only 50 in a minute. So you can see somebody who took too much Cicuta virosa in an experiment has a symptom almost perfectly matching Peter's symptom. Here are more symptoms: twitching and jerking of the head, and frequent involuntary twitching and jerking of the arms and fingers, the lower extremities, and the head. So you can see this by similarity, how similar in the experiments of Acute verosa symptoms are to the symptoms of Peter's case of PANDAS. And because they're uniquely matched to his case, different than other cases of PANDAS, that's why we give the match based on like cures like. So what happened in Peter's case? After a month of homeopathic treatment, Peter was already starting to improve. The OCD was almost gone, and occasionally he would stop at the door like a routine, but he wasn't getting stuck to the point where he couldn't walk through the door. And his staring spells and catatonic frozen episodes were significantly improved. The tics had been almost gone for 3 weeks, but they just started to come back the week before his follow-up visit. And they were still improved about 75% since we began treatment. Now, because the tics were initially better but then slightly relapsed, this was an indication that he had developed a tolerance to the 30C potency of Acute verosa and was no longer sensitive to it. So we had to change the potency of the homeopathic remedy. That can be common, and I'm going to show you that this pattern is an expected response with homeopathic treatment. So a good response, you'll see by this graph, with homeopathic treatment is after the remedy is given, the patient will improve, and at some point that improvement will plateau, and if we don't catch it during the plateau, the improvement may start to relapse. Now the important thing is with long-term homeopathic treatment is to keep very regular follow-ups, both when a child is doing well and when they're not doing well, so we can track the progress and make changes. And sometimes because I'm tracking really subtle changes, I may catch something before a parent does, which is why it's really important to keep your regular follow-up visits. And so in this case, the symptoms may start to slightly worsen, like happened in Peter's case, and if we then change the potency to a new potency or a new dose of the remedy, we start to see improvement again. And that's what we want. We want to keep stimulating the body to self-heal because that initial dose the body became tolerant to and then stopped triggering that self-healing response, and so it needed another nudge to keep healing and to continue improving. And that is a very common process, and it's like we go 2 steps forward and then maybe take 1 step back and then make 2 steps forward again. Now, if, let's say, the parents had quit treatment then when he had started to relapse, the risk is that he was still not yet fully out of the woods. We had a really good start to the case, but he could have fully relapsed, and then if they stopped treatment, he wouldn't have gotten better. So the point is that with homeopathy, we're stimulating the body to self-heal, and the immune system needs nudges in the right direction. And early on in treatment, it's going to need much more nurturing and support to keep that positive healing and stimulation of the immune system to heal. So when we have these slight relapses, it's really important to make an appointment and follow up so that we can then make a slight change to the treatment and keep the improvement going. And so since the symptoms of the case were still well covered by Acute verosa, we simply increased the potency to Acute verosa 200C, 2 pellets dissolved in his mouth once a day. And at that first visit, Peter's dad said, "I've seen a lot more with homeopathic treatment in 1 month than all the other therapies in over a year." Now, after 1 month on the 200C, he returned for his first follow-up, and his dad reported he's doing really good. He's back to normal with doing yard work and chores. His OCD was completely gone, and he was no longer having trouble walking through doors. He was also no longer having any staring spells, tics, or rages. Additionally, Peter was coming out of his shell and talking more. His dad said, "I still can't believe that after doing other treatments for a year, it was so difficult to get him doing stuff. Since coming to you, he's doing so much better. We lost a year of school over this. I'm not sure why we didn't start homeopathy sooner." And I can't tell you how many parents tell me this. They wish they started homeopathy sooner, and homeopathy seems to be the last resort, like the best kept secret. And my goal in giving this presentation is to tell people that it doesn't have to be the best kept secret. You should get homeopathic treatment because there's a good chance that it can help your child. Now, 2 months after starting the Secuta 200C, his parents said he was doing well enough that he signed up for some online high school classes to finish out the spring. And they were making plans to enroll him back in high school the next year. His parents said, "It's been night and day." And 3 months after starting the Secuta Verosa 200C, Peter said, "I'm doing great. I'm pretty much back to normal. I've had a great summer. I'm going back to high school where I used to go before." His father reported he doesn't have any symptoms. So Peter's response was rapid and dramatic, which can happen with very accurately prescribed homeopathic remedy. You could see when I gave you those symptoms in the Materia Medica how perfectly the symptoms from an experiment of Secuta matched the symptoms of Peter's disease. And when we get a match that is that dead on perfect of a match, the response is much more dramatic than if we have a partially similar match. Now, not all cases respond as quickly as Peter's, especially if it takes a few months of trial and error to select the most optimal homeopathic remedy. And the nature of PANDAS is episodic, with a susceptibility to relapse if the child gets a new strep throat infection. And Peter's case is a good example that improvement often progresses with 2 steps forward and 1 step backwards. And it's important to maintain consistent follow-up appointments so that we can catch when the symptoms are starting to relapse. And like this happened initially with Peter's tics. And it also happened, remember, if you look back to Julia's case, she improved for a while and then stopped responding. And so then I needed to change the potency in her case as well to continue to stimulate the child's innate healing process. So that's a very typical response with homeopathy. And the more years that a child's been sick, generally the longer it will take to fully reverse the symptoms so that a child no longer is prone to relapse. So if a child has been sick for several years, you may see improvement within the first few months of homeopathic treatment, but it's important to know that the child will probably require several years of treatment in order to get to the point that all the symptoms are completely gone and they're not susceptible to relapse, let's say if they get sick again or get a new strep throat infection. And a typical trend of improvement with homeopathic treatment can be visualized with this graph. So this is what I mean by 2 steps forward and 1 step backward. With homeopathic treatment, they may take 2 steps forward and then 1 step back, and then we'll change the potency, 2 steps forward and 1 step back, 2 steps forward and 1 step back. And at each junction, we continue to change the potency, or if the symptoms change, we give a different remedy to keep stimulating the body to get better and better. And slowly over time, the child gets better and better. And when they relapse, the relapses never go back to the original symptoms before they started treatment. Let's do one more case, and then we'll wrap up with some finalizing thoughts on homeopathic treatment. So this is the case of Billy, who was a 12-year-old boy who was first brought to see me for a treatment of PANDAS and PANS in June of 2015. And Billy's challenges started as early as 2 years old with speech delay, for which he received early intervention play therapy. And over the years, he had seen many specialists at various well-known places in Phoenix, the Southwest Human Development, the Melman Center, and Phoenix Children's Hospital, amongst others. And he was put on many medications, including an SSRI, which is an antidepressant, Lexapro, and later Prozac for his moods and anxiety. And also, ever since he was a little child, he was severely constipated. But his biggest challenges started when he was 7 years old, after he had a strep throat infection on a Labor Day weekend. And he was treated with antibiotics, yet slowly over the next 2 months he started developing PANDAS symptoms. He began having intense fear of contagious diseases with other OCD behaviors. Additionally, he began having tics, which started out with throat clearing, which is a vocal tic. And in 2010, he developed a chest and sinus infection that caused the acute PANDAS symptoms to worsen even further. And his tics worsened, and he developed explosive outbursts related to his OCD. And over the years, he saw several specialists, including neurologists and allergist immunologists. He was treated with steroids and IVIG, which is another common treatment for kiddos with PANDAS. And despite this, his symptoms remained largely the same. And when he came to see me in 2015, he had multiple tics, including a high-pitched squeak and skipping while walking. He was also having daily meltdowns that were usually triggered by his OCD, like if his sister or another child sat in his chair at school. And if a child sat in his chair, he would start screaming. He would run out of the classroom and refuse to come back. He would start screaming, become angry, and throw things. And he was put in a self-contained classroom at school for emotionally disabled children. Yet he was barely able to get any learning accomplished because of his behavioral problems. So this is a really big problem. Most days he was being sent home early, running out of the classroom. Essentially, he was going to school to babysit him for these behavioral issues. And in addition, Billy had very severe chronic sinus infections following allergies. His nose was constantly blocked up. And he was also chronically constipated, and he was being treated with X-Lax 3 times a day, or else he wouldn't even have a bowel movement. He was also diagnosed with ADHD and attentive type. He was very fatigued and would often have very low stamina. He could often barely make it walking at Disneyland for a few hours and then would have to retreat back to the hotel. Can you imagine? The poor kid couldn't even go a whole day at Disneyland without getting too tired. And he had many sensory integration problems, including sensitivity to tight clothes, bright lights, loud noises, strong odors, and he was very sensitive to being too cold, and even in the Phoenix summers he would wear a sweatshirt with a hoodie. Now, over the years, Billy's parents tried many interventions, including surgery to remove his tonsils and adenoids. He had sinus surgery. He received occupational therapy, speech therapy, sensory integration therapy. He was put on psychiatric drugs. He tried IVIG, supplements, antibiotics, and other drugs. And when Billy first came to see me for treatment, he was already taking 7 medications prescribed by another doctor, including Augmentin, which is an antibiotic, minocycline, which is an antibiotic, Plaquenil, which is an antiparasitic, X-Lax, laxative, Flonase, steroid nasal spray, Prozac, and Abilify, which is an antipsychotic because of his behaviors. He was also on a long list of 12 supplements. Now, taking these 19 drugs and supplements per day was like a full-time job for his mom to orchestrate. You can imagine this child was very sick and very distressed, and my heart just went out to him because I hate to see a kid suffering like this. And his mom is a saint. She does everything for this kid and is willing to do everything for this kid, and thankfully, eventually she tried homeopathy. Now, this case has an important lesson because I started the case with a homeopathic remedy, chamomilla. Some of you know chamomile, which is often a valuable remedy for kids with anger outbursts. But unfortunately, at Billy's first follow-up visit, he did not show any signs of improvement. And this is a really important message that I want parents to get. Some cases magically improve right off the bat with a very good homeopathic prescription, like Peter's case that I just presented. But not in Billy's case. I prescribed the wrong medicine or a poorly matched remedy as the first remedy in Billy's case, but thankfully his parents didn't give up and they came back for his follow-up visit. So I reassessed the case and prescribed a different homeopathic remedy, Nux vomica, 30C. I had him dissolve 2 pellets dissolved in his mouth once a day. And here is a picture of the Strychnos Nux vomica plant. And we give a very safe small dose that's a highly diluted safe small dose. And the Nux vomica is an important remedy for kids with anger outbursts, OCD, constipation, severe constipation, tics, and sensory sensitivities to lights, noises, odors, tight clothes, and becoming too cold. And it's a really important remedy for constipation and sinus infections. So you can see that holistically, I prescribed Nux vomica because it matched all the symptoms in the case, including the tics and the OCD and the outbursts and the constipation. Because we holistically want to give one remedy that stimulates healing as a whole. So what happened? Within the first 2 weeks on Nux vomica, Billy decreased from 2 to 3 massive tantrums a day. And when we say massive, we're talking about screaming in a ball, sitting in a ball, screaming for 20, 30 minutes at a time. where he either runs out of the classroom and is screaming in the hallway, or he completely disrupts the classroom or the home. He went from having 2 or 3 of those a day to only having 1 in 2 weeks. And he even had a day when another child sat in his seat at school and it didn't trigger a massive meltdown due to his OCD. And over the course of the next 9 months, Billy steadily improved. Every couple of months, we had to change the potency of the Nux vomica when his improvement stopped in order to keep the healing process moving in a positive direction. Billy now rarely has meltdowns, and his OCD is significantly reduced. And his teachers reported that he learned more in school in the past year than in the past several school years combined, because his behavior was so much better that he was actually now able to learn and complete assignments. It was huge. And he no longer had the fear of germs, but he did still have a little bit of an obsessive tendency to get fixated on certain topics. His mood was so much improved that he was now frequently telling Mom that he's the happiest kid alive. And his constipation was slowly improving, and we were gradually able to wean him down to about half of the dose of X-Lax over the course of about a year. And I want to note here that in chronic laxative abuse, there's a rebound worsening when trying to get patients off of these. So it's a very, very slow process for a patient who's been on laxatives for as many years as Billy. It's a very slow process to wean him. Additionally, his allergies and sinuses were significantly better, and he was not having any problems with breathing, even through the spring allergy season. And he was still having some minor tics, which may require a different related remedy, although it's coming to my mind when I wrote this up, the tics had not been improving, but at this current time, the tics are now starting to improve. Which brings up an important point. With a remedy that's stimulating healing for the whole person, we can't necessarily pick which things get better first. We just give the medicine, and then the body's immune system chooses what gets better first. And it may be the behaviors or the constipation or the sinus symptoms. In Billy's case, those symptoms all improved long before the tics started to improve. And by the time we had weaned the X-Lax to half the original dose, which is about a year after treatment, he was completely off the Abilify, minocycline, Plaquenil, Augmentin, and 5 supplements. Additionally, Billy was working with the prescribing doctor to slowly wean off Prozac, and eventually he got off Prozac completely. Now, despite the fact that he still had some remaining tics, Billy's mom preferred to stick with the Nux vomica because he was still doing well. And she said, we're still taking away medicines. He's still doing well. I don't want to upset the apple cart. And eventually, the tics started to improve as well. Now, this case illustrates that sometimes there's a little trial and error involved with homeopathy because every case is so unique and individual. And because I look at with homeopathy, we look at each case as unique and different. And so the unique symptoms in each specific case guide us to pick a remedy. And even though we completely struck out and prescribed the wrong remedy in the first time when we gave chamomile, thankfully Billy's parents stayed committed to homeopathic treatment. And, if they had given up right away, then we wouldn't have had a chance to prescribe the second remedy that turned out to be a huge success. So, the good thing with homeopathy is that we only use one remedy at a time to stimulate self-healing holistically simultaneously with many seemingly different health complaints like his constipation, tics, sinus infections, OCD. But since we only prescribe one remedy at a time, it's much more clear when a prescription fails so that we can stop it, check that off the list, and move on to the next individualized homeopathic prescription. And sometimes kiddos with PANDAS and PANS are taking so many medications and supplements that the parents can't even tell what's working and what's not. And in the meantime, it's a circus to get the kid to take all of these prescriptions, not to mention it costs a small fortune each month to maintain that medicine and supplement regimen. So like a lot of kids that I've helped with PANDAS and PANS, Billy was able to slowly wean off much of that laundry list of medications once his symptoms began to improve. And that brings up another point that I'm going to talk about towards the end of the talk, which is that I try to keep as many variables as constant as possible and then slowly wean the medications only once the child is already improving. Now, because Billy was sick for so many years, over 5 before he came to see me for homeopathic treatment, it's realistic to expect that he will continue to progress in a slow and steady manner, but it's going to probably take a few more years to completely resolve all the chronic health problems that he originally came in with. But the big message here is slow and steady wins the race. I can't emphasize this enough for parents. I don't want you to have the expectation that your child will be magically completely cured in a month of this very devastating condition. Often, it's been going on for a long time, and it's an intense process that's really mucked up the immune system. And to get a child healthy again takes time. And so I like to tell parents that it's more like a marathon than a sprint. And if you have that outlook, you're going to be like Billy's parents, and you're going to have a much better prognosis for a positive outcome. Because if we accidentally prescribe a wrong remedy first, like I did for Billy, that gives us some time for some trial and error to try to hone in on a more accurate prescription. So this is what Billy's mom said. She said, after exhausting a long list of allopathic, naturopathic, and integrative treatments for my child's complex medical diagnosis, including PANDAS and PANS, developmental delay, and multiple other labels, I skeptically resorted to Dr. Oskin and started classical homeopathy. While all the other therapies did help somewhat, the gains achieved from a simple, easy-to-administer remedy that had been astounding and long-lasting. My child's mood and anxiety started to improve almost immediately, and month after month I continued to see steady gains in multiple different body symptoms and have been able to discontinue several prescribed medications. A sense of calm has returned to our home. I'm only sorry that homeopathy was the last on my list of things to try instead of the first. Dr. Oskin is very caring and passionate and has a passion for his field. You won't regret this safe and proven method of treatment. And I'm so grateful for her for this testimonial, so you can see, this is a mom who's been down a difficult road with a kid who's been sick for a long time. And thankfully, we've been able to help him with homeopathy. So with that, I want to follow up with just a couple more slides to talk about expectations for homeopathic treatment. If you're a parent thinking about getting homeopathy for your child, I want to make sure we set you up for success. The first thing is the timeline. There is a very lengthy new patient process and interview. My new patient intake is a long one because I need so many details to individualize each unique case of PANDAS or PANS. And I'll do a physical exam, and because of that, you should expect about at least 2 hours for the very first visit, and sometimes I do another hour and a half or 2 hours, and depending on the case, we may investigate nutritional or lifestyle exercise things that we need to talk about to just build the foundation for health. But the homeopathic intake process is a lengthy one, and you need to be prepared for that. The other thing is that homeopathy works slowly over time by stimulating the body to self-heal. So you should expect to have monthly follow-up appointments for at least 1 to 2 years or more. And then for kids who've been sick for many years, you may expect several years of treatment. Now, they may begin to improve very rapidly, like Billy started to improve pretty rapidly in the first week on the right remedy. But to get him completely off all of the medicines and so that he doesn't relapse with a new infection, it's going to take several years of treatment to the point where his immune system is so solid that it's not going to relapse. And like we looked at with the graph, often with homeopathic treatment, there's 2 steps forward and 1 step back, and it's important to keep your follow-up visits at regular intervals so that when there's a slight relapse, we can catch it and make a change to either the potency or prescribe a new remedy if needed to keep the improvement going. And there's often some trial and error involved to identify the most optimal remedy and or sometimes the most optimal dose. So like in Billy's case, we didn't prescribe the right remedy first. Thankfully, the parents stuck with it. There was a little trial and error to find the most individualized remedy in his case. And thankfully, we got it in his case on the second try. But please be aware that the prognosis will significantly improve if you have patience for this trial and error. I want to discourage you from having the thought that your child's going to be magically cured in a month, because I don't want you to, in case the first remedy doesn't work, I don't want you to waste a lot of time and money coming to try homeopathic treatment and then giving up saying that it was a failure if you only give it 1 or 2 shots and then you're done. It's much more likely to be successful if you think of it like a marathon and are in it for the long haul, because if there's some trial and error involved, it's going to much more likely result in our ability to hone in and individualize in your child's specific case. Now, another point. PANDAS and PANS kids are very sensitive to remedies. They're often very sensitive to everything, and they respond really well. But because of that sensitivity, in about 15% of cases, maybe 20% of cases, there is an initial worsening that the remedy in the first week or so may trigger a worsening of the existing symptoms, is where the symptoms get worse before they get better. And that's actually a really good sign. When that happens, we sometimes jump for joy because it means that improvement is on the way. Now, it's important if that happens for your child that you call your homeopath or you call me and we stop the remedy or we help modify the dose so that the storm can pass more quickly and then move on to start the improvement. And we will manage and help you through that time, but certainly we want to let you know that it is possible that the symptoms could get a little worse before they get better. And not to worry when that happens, it's a good sign, but to make sure you contact us so we can help you manage it. This is really, really important, and it can make a really big difference in a very sensitive child. And sometimes your patience is required while we figure out the right potency and dose and the frequency of dosing. Some kids need a dose every day. Some kids need a dose of the medicine once every 3 days or once every week or maybe even less. It just depends on how sensitive a child is to the dose of medicine. Now, many PANDAS and PANS kiddos are seeing other naturopathic doctors or other integrative doctors and are already coming in. When they come to see me, most are already on many medications, supplements, and therapies, which you could see by Peter and Billy's cases. Now, my approach is very different than many of the approaches out there for PANDAS and PANS. I like to keep the variables as constant as possible and only introduce one new thing at a time. And I only very slowly wean the other supplements and medications only after the child is steadily improving and at a new level of health. So if a child comes to me on a laundry list of 20 different things, I will not change that when I start treatment. This is really important for parents to hear. I will not change the list of things they come in on when we start treatment. I need to keep that all constant so that when I introduce the homeopathic remedy, we know what improved from the homeopathic remedy. If we stop those medications or supplements at the same time as starting the homeopathic remedy, let's say the child gets worse. Well, now we don't know if they got worse because they're having that healing aggravation where they get worse before they get better from the homeopathic remedy, or if they got worse because one of the medications or supplements was helpful. So we need to only change one variable at a time. It's much more scientific, but it also allows us more pragmatically to manage the case better. And I know that parents who are under distress because their children are suffering they care so much and they love their kids so much, they want everything to get better right away. And sometimes they're like, I don't care, I just throw everything at them, I just want them to get better. And although I can sympathize with you because I know how much your child is suffering, I really want to emphasize that it's much better for the long term if we're careful and methodical with how we go about things, because I really don't want my patients taking $500 or $1,000 worth of supplements in medications every month when maybe half of them aren't working. We need to know what's working and what's not working and change things very carefully. So when I start a kid, I start them only with one new medicine at a time. And only after they've been improving for several months and they're stably improved do we then slowly begin to wean the medicines. And sometimes weaning the medicines actually may cause a temporary worsening of the symptoms, in which case we will need to more slowly wean the medicine or adjust the homeopathic treatment. So please be careful about that. Sometimes, for example, like X-Lax, a patient who's on a laxative, if they wean their laxative medicine, they may get rebound worse constipation. So then I may have to adjust the dose of the homeopathic medicine to help cope with the rebound worse constipation, to help cope with that. So the weaning process we have to do very carefully. And I do want to educate you that many other doctors may mention using homeopathic remedies. Most of them are using either combination remedies that are kind of a shotgun approach that have maybe a bunch of different homeopathic medicines in there, but they're not having a nuanced expertise with prescribing one homeopathic medicine at a time based on very carefully analyzing the case based on the unique individualizing symptoms of the case. That's what I do. And/or some of these other people are not necessarily experienced with PANDAS or PANS. So I really recommend, because PANDAS and PANS is such a complicated health issue, make sure you see a health practitioner with an expertise in real homeopathy and also experience with PANDAS and PANS. So by real homeopathy, I mean there are some terms you can look out for. Classical, Hahnemannian, pure homeopathy, orthodox homeopathy, or my favorite, good old-fashioned homeopathy. By the book, the way it was intended, the way the method was discovered and implemented by Hahnemann. So this is using one medicine at a time and matching the medicine very specifically based on similarity to the patient's disease. That's what I mean by real homeopathy. And make sure you're seeing someone who only uses one remedy at a time. It keeps the variables constant so we know exactly what's working and what's not working. Even if something doesn't work, I know that it's distressing when something doesn't work, but hang in there. It's much better for the long-term prognosis if we can keep the variables constant and know what's working and what's not working. And lastly, we treat the whole person, including the entire pattern of symptoms. The behaviors, the OCD, tics, stools, skin, bedwetting, you name it. And even if conventional medicine would consider these unrelated problems that all need separate drugs or supplements, with homeopathy we look at them all as a unique holistic picture. And we try to pick one homeopathic medicine that will stimulate self-healing across the whole person so that multiple symptoms will improve simultaneously. So I hope that has really helped you understand a little bit about homeopathy and what we can do to help kiddos with homeopathy. I'm really passionate. My heart just goes out to these kids. I love helping these kiddos, and it breaks my heart to see them suffer. And, we have really, really safe, gentle, natural medicine with homeopathy that can help children with PANS and PANDAS. And for more information, if you'd like to set up a free 15-minute consultation, I'd be happy to talk to you to see if your child would be a good fit for homeopathy. Call the office today at our number below, 480-456-0402, to book a free 15-minute consultation so that we can get your child on the road to recovery. And lastly, feel free to check out our website, aznaturalhealth.com, and search on there for our PANDAS website page. Thank you again. This is Dr. Oskin, and I appreciate you taking time out of your busy day to hear this talk. Look forward to helping you.